Hello, hi everyone. My name is Zunarain binti Muhammad and I am from Bachelor Psychology Cohort 8 and today I will be your presenter. And today's topic is under chapter 4, Health and Prevention. The topic that we will discuss today is arthritis. So for no further ado, we will go to the next slide. So this is the content for these slides, and the thing that we will discuss today is consists of what is arthritis, what are the symptoms of arthritis, what may cause for the arthritis, and even what are a possible treatment for arthritis, and maybe also how to prevent the disease. So what is arthritis? Arthritis means inflammation or a swelling of one or more joint. So we can take for this picture. There's a swelling around our joint. We can see at our finger there is a joint between it, and some that may causes it to be swollen. So we will discuss it on it later. And arthritis is described more than 100 conditions that affect the joint, tissues around the joint, and other connective tissues. Specific symptoms vary depending on the type of arthritis, but usually include the joint and stiffness. So this illness may usually be known for someone as they get older. It may be right, but it does an effect on it does effect on the children too. In that matter, we will discuss it later. So for the next slide, uh, today I will discuss several of type of arthritis because it is important to know which one you have, and there are some similarity between this condition, but there are also some of key differences between it. So the arthritis of that I will discuss is osteoarthritis, rheumatoid arthritis, gout, psoriatic arthritis, and juvenile arthritis. So for the first type of arthritis is osteoarthritis, which is OA, is a chronic progressive musculoskeletal disease. This OA is characterized by a gradual loss of cartilage in joint, which cause the bone here they rub together, and most commonly affect for the joint in the knees, hand, spine, and hip or feet. OA is more common in women than men. Nearly 45% of women over the age of 65 years old have the symptoms, while 70% of those who are over 65 years old radically evidence of the OA. But most of the symptoms include pain in the joint, especially knee joint, stiffness in the joint, and a decreased range of swelling. So OA is the most common type of arthritis and most known between all, and it is estimated that around 8.75 million people in the UK have seen a doctor and talk about osteoarthritis. But there is no a specific cure for arthritis, but with the plan, right treatment plan can help you to stay active while you have this type of arthritis, and it will prevent you a joint damage or limit injury and manage pain. Sometimes the early stage of osteoarthritis can happen without causing much pain or trouble. However, it can lead to damage inside a joint as well as pain and stiffness. Um, so that being overweight can also make you more likely to get osteoarthritis and can make it worse. So next, the two type of arthritis is a gout. Gout is another common type of arthritis that is caused by a disposition of uric and acid crystal in joint, which result in inflammation and pain. Some common symptoms stated in this slide is a formation of nodules under the skin called topy, or a swollen joint like the other one, joint redness. This type of arthritis, we can see that it very typical with the elderless, and these common symptoms also may be joint pain and warmness in joint. So that often that someone with gout, they can feel that around the red the swollen, you feel warmness in there. So for gout, treatment may depend upon the severity of the condition. The joint treatment mainly comprise of anti-inflammatory medication. This is type of uh, one of the type of medication for gout, for even arthritis, and lifestyle medication such as indulging in physical activity. Following a healthy diet and limiting alcohol intake, it typically affect the big toes. But gout is commonly for affecting at around the toes, but also can affect other joint in the body. So, however, being overweight or eating or drinking too much of a certain type of food and alcohol drink can cause some people to have more urate in their bodies. So the gene you inherit can make you more likely to develop gout. If it's reach a high level, the one that you rate in your body, urate can form into a crystal that remain in around the joint, and they can be there for a while without causing any problems, and even without the person even realize that they are there. So that because we as a human, we all need calcium to make bones and to make the teeth strong. However, some people can have too much calcium in their bodies, which can form as a crystal around the joint. This can lead to painful swelling and might be as well as you get a gout. So, okay, for the third type of arthritis is a rheumatoid arthritis, which is we call it as a RA. It is an autoimmune disease and abnormal immune symptoms in which the body immune system work to protect its health by fighting a foreign substance like bacteria and virus that accidentally attack the joint. RA affect the lining of your joint, causing a painful swelling that can eventually result in erosion and a joint deformity. Most common symptoms for RA is a fatigue, lack of energy, maybe minor fever, or joint tenderness, joint painful at the joint, and may cause some stiffness, and also warmness and redness around the joint, and also joint swelling, and might also cause that person to lose some weight. But the immune system in a body naturally is a self-defense system, and it's protect us from infection and illness. When someone has an autoimmune condition, the body immune system mistakenly attack the the body healthy tissues such as the joint, causing inflammation. RA is a chronic condition with no cure. However, physiotherapy and anti-rheumatic drug can help slow it progression. Inflammation is an in as a is a normally an important tools in the immune system. It's occur when the body send uh, an extra blood and fluid to an area to fight an infection. This is what happened when for example, if you had a cut, the cut that gets infected and the skin around it becomes swollen and becomes different colors. So as well as causing pain and stiffness, inflammation can cause permanent damage to a joint. Starting to effect treatment, starting an effective treatment early can help someone to minimize the damage. And rheumatoid arthritis often start in a small joint, uh, maybe at around your hands and feet, and it can affect the same joint on both sides of the body at the same times. It can start quite slowly and then gradually get worse, or it can start more aggressively even in the beginning. So we move on to the next one. The fourth type of arthritis is psoriatic arthritis. This kind of arthritis is a joint disorder often accompanied by a skin infection called psoriasis. Under this condition, the immune system of the body attacks the healthy tissue, leading to inflammation in the joint. And some general symptoms for this arthritis is swollen, same with the other, and a tender joint, swollen finger. Your finger will be swollen, or your toes too, and you might feel morning stiffness, or maybe painful muscle and tendons, and you might get a scaly skin patch, which may get worse when the joint pain also occur at the same time. So, a treatment for psoriatic arthritis may include a medication to reduce inflammation, which is steroid injection or joint replacement surgery. Might also your lifestyle changes, because the body immune system can cause swelling and stiffness within around the joint, as well as red scaly skin rashes called psoriasis. The rash can affect several places in the body, including elbows, knees, your back, your buttock, also scalp. And psoriatic arthritis usually affect people who already have a psoriasis. However, some people develop the arthritis before this you even get the psoriasis. It's possible to have arthritis but no psoriasis at all, and this condition can affect people of any age, but it tend to affect on adult. So for the last arthritis is a juvenile arthritis, which is this is a long-lasting chronic disease. It is most common form of arthritis on children. Juvenile arthritis is a condition that encompasses 100 other autoimmune and inflammatory conditions, such as juvenile idiopathic arthritis (JIA), juvenile dermatomyositis, juvenile lupus, and juvenile scleroderma, and etc. The common symptoms for this arthritis is limping. The child is not able to perform motor skills efficiently, or joint stiffness, especially in the morning, pain, swelling, and tenderness in the joint, and might also a persistent fever or irritability, and also can cause weight loss to the children, rash, and fatigue. So for this type of arthritis there is actually no cure for juvenile arthritis. However, timely diagnosis and the right treatment can relieve and also control the pain, relieve inflammation, and improve child quality of life. The the treatment plan usually comprise a combination of medicine, a healthy diet, and exercise. If if someone is diagnosed with inflammatory arthritis, or if this kind of arthritis before their 16th birthday, is called a juvenile idiopathic arthritis, or JIA. There is a different type of JIA because there are auto type of JIA, and there are autoimmune or condition, and their immune system can cause pain and swelling in the joint. The earlier someone is diagnosed with JIA, the better. This is so that an effective treatment can be started and limit any damage to the body. There are also drugs that can treat the symptoms, such as painkiller and non-steroidal anti-inflammatory drug, which is NSAIDs, or also a disease modifying anti-rheumatic drug, and maybe a biological therapist can slow down or stop the arthritis causing the swelling inside the body. So we will go on to symptoms of the arthritis. When you hear term of arthritis, it is easy to think that it's a bothersome pain, and while pain is a very prominent sign of the condition, arthritis can bring about the symptoms too. Thankfully, uh, there are a lot you can do to keep the symptoms to a minimum, especially if you seek proper care early on. So, the symptoms, the two common type of arthritis that affect many adults in the United States or even in the world is osteoarthritis and rheumatoid arthritis. The most common sign and most common on this which if someone had arthritis, because it is also depend on the type of arthritis, and but uh, maybe for the least common type of symptoms that if um, someone is might have arthritis is, number one is pain, or someone might feel pain around your joint, or you might like perasan that you have a stiffness around the joint, or might have a swelling around it, or redness. Maybe if you have a redness or warmness in your swelling in your joint, it means that you might have a gout, and that's why ini discrete range of motion, and you might macam perasan like you had macam you not get to move or active like before. If you notice, if you notice that your joints are as flexible as they used to be, but are more frequently stiff and sore, it may be due to arthritis, because there are more 100 of different type of arthritis that can develop as you get older or following an injury. The many type of arthritis target your joint, causing pain, inflammation, and stiffness, or even limited your joint flexibility. So, most common common sign, maybe the early sign of arthritis is for the osteoarthritis. This kind of arthritis is a degenerative joint disease that affect the soft tissue that line your joint. Your joints are made of bone, cartilage, and ligament that all work together to give you range of motion. Owing to the age-related change in your body, the cartilage that line the end of your bones in your joint begin to break down and wear away, because you are already in phase of adult, maybe mm, the phase of you're in for your 40s and up. This cartilage normally protect your joint and prevent the bone from rubbing together. However, without these tissues, movement create friction and inflammatory in your joint that leads to pain. Rheumatoid arthritis is a type of inflammatory disease also. This kind of arthritis also target the lining of your joint, but it's your immune system that mistakenly attack the otherwise healthy tissues. The attack causes chronic inflammation and pain that make it difficult to move your joint. Arthritis can develop in any of your joint, but especially common in your knees, spine, wrist, and hips. Over time, without even if without treatment, it can limit your physical mobility and leave you in a chronic pain. Although there's no cure for arthritis, and treatment have improved greatly in recent years, and for many types of arthritis, particularly inflammatory arthritis, there are a clear benefit in starting a treatment at early stage. So early sign for arthritis is that joint pain may occur until your arthritis is well advanced. Some early signs may include morning stiffness. So this kind of stiffness is when you first wake up. It's often sign of the early stage of arthritis, because if you felt that some pain and on a joint and it lasts for a few minutes of your developing, or a few minutes, you might develop osteoarthritis. If it lasts for a few hours at a time, it may indicate that you have a rheumatoid arthritis. Or the second sign is a joint swelling. Swollen joint is a typical of uh, swollen joint is a sign that your arthritis is worsening. A joint may appear noticeably larger than usually, and you may notice that they feel warm to touch. It's like a gout. And swelling in your joint can occur occasionally at first and last for several days. As your condition worsens, your joint may be frequently swollen and difficult to move. A third a third sign is a fever. So you might present that I've told you from early one that common symptoms for arthritis is a fever, and RA, uh, one of the type of arthritis that can cause you a fever, and this type of arthritis can cause low grade fever. If you have a fever and also at the same time you have a joint pain, it can be an early sign of arthritis or an underlying infection. However, there are other signs that you should look out for to help you stay on top of your condition. The fourth sign is numbness and tingling. You might feel numbness and tingling around your joint, and when you have arthritis, your joint become inflamed. They can put pressure on your nerve. This pressure are the causes for numbness and tingling sensation in and around the joint. You may also feel burning sensation that radiate into other parts of your body and when you move your joint. And the last sign is a chronic fatigue. You feel like you lately that you feel so fatigued and don't have any energy to do anything, the like activities that usually can do, but for the lately you can't do as much as you can do before, because this is a not so obvious warning sign. Is a chronic fatigue. As your joint wear down, you may feel unusually tired. A fatigue can occur before other more obvious signs of arthritis begin. Some people experience fatigue that lasts for a few days but progresses to longer period of time. It's common to have an stiffness or and pain in your muscle and joint from time to time. This may especially be true if you take part in unusual or strenuous physical activities. So, how can you tell the differences between early sign of arthritis and normal pain or stiffness in your joint? And how do you know when you should see a doctor about your symptoms? So, if you have a swelling or stiffness that you can explain and it doesn't go away in a few days, or if it becomes painful to touch your joint, you should see a doctor. The earlier you get diagnosis and start the right treatment, the better the outcome will be. So we go to the what causes for the inflammatory or the swelling to come uh, to be happen. It may difficult to say actually what has caused for your arthritis. There are several factors that can increase the risk of each type of arthritis. It could be that genes that you are inherited from your parent or grandparent make you more likely to get arthritis. So arthritis is involved the breakdown of structure of the joint, particularly cartilage, and normal cartilage protect a joint and allow it to move smoothly. Cartilage also absorb shock when pressure is placed on the joint, such as when you walk. Without the normal amount of cartilage, the bone under the cartilage become damaged, and when you see in this picture, and and it rub together, and this cause swelling and stiffness. Other joint structure affected by arthritis include the synovium, the bones next to the joint, ligament and tendons, and also the lining of the ligament and tendons, called as a bruising. Arthritis can make life tough by causing pain and make it harder to get about, and the symptoms of arthritis can vary from week to week and even from day to day. Many types many types such as osteoarthritis and rheumatoid arthritis are long-term condition. However, with the right treatment and approach, you can manage your symptoms. So in most cases, the inflammation goes away after the cause go away or are treated. Sometimes it does not goes away, and when this happens, you have a long-term, a chronic type of arthritis. Arthritis may occur in people of any age or sex. Osteoarthritis, which is due to a non-inflammatory process and increase with age, is the most common type. So whatever condition you have, remaining physical active will help you to stay mobile and will be good for your general health. Most of the joints in our body are surrounded by a strong capsule. The capsule is filled with a thick fluid that helps to lubricate the joint. This capsule hold our bones in place. They do they do this with the help of ligaments. These are a bit like very strong elastic band. The end of the bone, as you can see, within a joint are lined with cartilage. This is smooth but tough layer of tissue that allows bone to glide over one another as you move. So if we want to move a bone, our brain gives a signal to the muscle, which then pull a tendon. So this attached to the bones. Muscle therefore have an important roles in supporting bones. So if you have some problems with the type of the so if someone had problems with the cartilage. These are most causes to the inflammatory, and this might have caused you to have arthritis. So for treatment, possible treatment for arthritis is, the firstly you have to get a proper diagnosis for this. During physical exam, doctor check your joint for swelling and redness and warmth. They also want to see how well you can move your joint. The first type of test that you can do to see what type of arthritis or even what kind of illness, a disease that you get, is laboratory tests. The analysis of different type of body fluid can help pinpoint the type of arthritis you may have. A fluid commonly analyzed include blood, your urine, and even joint fluid. To obtain a sample of joint fluid, doctor cleans and numb the area before inserting needle on the joint and space to withdraw some fluid. And the second type of diagnosis you can use to diagnose your what cause of your symptoms or even detect problems on your joint is using an X-ray. X-ray is a low-level radiation to visualize the bone. An X-ray that can show cartilage. So it's like on this picture, you can visualize damage or even bone spurs on your body, and X-ray is may not reveal an early arthritis damage, but they're often used to track the progression of the disease. So the second one is a computerized tomography called we know as a CT scan. Um, this one is a next level to X-ray, and CT takes many different angles and combine the information to create cross-sectional view of internal structure. So after you take an X-ray, you might also have to take a CT scan so that the doctor can observe two types of tests, so it can determine what causes for your symptoms and even what might you have developed uh, any type of uh, penyakit like that. So the third one is called magnetic resonance imaging, which is MRI. MRI is a combining radio wave with strong magnetic field, and this can produce more detailed cross-sectional imaging of a tissue such as cartilage, tendons, and ligament. So with MRI, you can see this one in this picture that it gives you more details on what are in your body, what are causes, what are the symptoms. It's not symptoms, like what cause you the pain. And also you can use an ultrasound. This technology use high frequency sound wave to image soft tissues, cartilage, and even a fluid containing structures near the joint. Also, ultrasound used to guide a needle placement for removing joint fluid or injecting medication into the joint. And next, we can discuss a possible treatment for arthritis. The one is number one treatment is the doctor may give you a medicine, and the medicine that used to treat arthritis is very dependent on the type of arthritis. Include NSAIDs, non-steroidal anti-inflammatory drug. It can relieve pain and reduce inflammation, or counter irritants. You have to rub this preparation on skin over your aching joint and may interfere with the transmission of pain and signal from the joint itself. Or you may also will be given an steroid corticosteroid medication such as prednisone to reduce inflammation and pain and slow joint damage. Uh, it may be given as a pill or injection into painful joint. And the last one is a disease modifying anti-rheumatic drug. This drug can slow the progression of RA and save the joint and other tissue for a permanent damage. So arthritis treatment focus on relieving symptoms and improving joint function. You may need to try several different types of treatment or combination of treatment before you determine what works best for you. These are drugs that can reduce the amount. Type, this fourth type of drug can reduce the amount of the urate in the body and prevent even a gout to attack. Example are allopurinol and febuxostate. If you have a gout attack, you will need short-term pain relief. A non-steroidal anti-inflammatory drug as well as paracetamol can be good drug to try first. According to American College of Rheumatology and Arthritis Foundation, non-steroidal anti-inflammatory drugs are one of the most effective OTC remedies for managing arthritis pain. And as AIDs can help reduce both pain and inflammatory. So the second treatment is a therapy. This physical therapy can be helpful for some type of arthritis, and exercise also can improve the range of motion and strengthen the muscle around surrounding the joints. In some cases, spleen or braces will be warranted for arthritis that are more serious. Also, the third one is a surgery. This will come if the conservative measure don't help, and mostly doctor may suggest surgery such as a joint fusion, a joint repair, or a joint replacement. So for a joint fusion, more often used for smaller joint, maybe around your hands, such as those in the wrist, ankle, and fingers. It removes the end of the two bones in the joint and then lock those ends together until uh, they heal into one rigid unit. For joint repair is some instance joint surface can be smooth or realigned to reduce pain and improve function. But this type of procedures can be performed arthroscopically through small incision over the joint. And for the joint replacement, this procedure removes the damaged joint and replace it with an artificial one. Joint most commonly replaced are uh, in your hips or your knees. But medication are not the only non-prescription osteoarthritis treatment. The two other treatments that can be maybe the right treatment for you. So for the last topic that we discuss is on how to prevent an arthritis. What can you do to prevent an arthritis? Because some cause of the arthritis are beyond our control, like a growing older or being a female or even having a family history with arthritis. But you can take steps to reduce your risk arthritis or even delay its onset. So first prevention that you can use is learn new self-management skills. These learning strategies is to make you better known to manage your arthritis and even can help you feel more in control of your health, manage pain and other symptoms, or with new self-management you can carry out your even daily activities like going to work. So because you have known what kind of uh, prevention, what kind of good lifestyle you can do to prevent you to even get an arthritis. So with a good one, you can carry out your daily activities uh, happily. So maybe it also can reduce your stress and even improve your mood. So with these new self-management skills, you can communicate better with your health care provider about your care for the elderly. So the second one is to be active. Physical activity is a simple and effective non-drug way to relieve arthritis pain, and being physically active can reduce pain and improve function, also your mood and quality of life for adults with arthritis. Regular physical activities can also reduce your risk of developing other chronic disease, and it can help you to manage these conditions if you already have them. As well as a medication treatment, there are many things that you can do to help yourself to manage your arthritis. You might not always feel like exercise if you have arthritis because of the pain that you had, and you might be worried that exercise will make you more pain, or your condition might be worse. However, exercise actually can make symptoms such as pain and swelling better. Um, the third one, for preventing and any disease or even arthritis, is to talk to your doctor. Talk to your doctor if you have a joint pain and other arthritis symptoms. It is an important to get an accurate diagnosis as soon as possible, so you can start early treatment, a treatment that suit for you and work to minimize symptoms and even prevent the disease from getting worse. So in this, if you talk to your doctor, you can play an active role in controlling your arthritis by attending a regular appointment with your healthcare provider and following your recommended treatment plan, because the focus of arthritis treatment is to reduce pain, and to minimize the joint damage, or even to improve or maintain function and quality of your life. You have to see a doctor if the pain isn't linked to any injury, or if the pain won't go away. If the pain came after unusual exercise or activity you have, or you might just undone it a bit, pain should ease within a few days. If joint becomes swollen and isn't linked to any injury, you should see a doctor. This is especially important if you are also unwell or have a fever, if this joint is red and warm. It's important to see a doctor if you get any symptoms, or if you have any trouble with drug you're taking. If you have an appointment with doctor to help, make sure you get most of most out of it. You could take the list of questions with you and take them off as they discusses. You could also keep a symptoms diary with the details of how you're feeling in between appointments. Some people find that taking a friend or relative with them to appointment can provide support and ensure that all the important points are discussed. So the fourth type of prevention is to manage your weight and keep in a good lifestyle. Losing excess weight and staying at a healthy weight is particularly important for people with arthritis. For people who are overweight or obese, losing weight might can also reduce stress on your joint, particularly weight-bearing joint like the hip and the knees. In fact, losing as little as 2 pounds can improve pain and function for people with arthritis, because at any age, low impact arthritis friendly physical activities like walking and dietary can change and help you to lose weight. And for the last prevention is to protect your joint. If you have a joint injuries, and it can cause or worsen your arthritis. So in this type of prevention is you have to choose at any activities that are easy on the joints, like walking, bicycling, or even swimming. This type of activities, those three are type of activities, low impact activities that have low risk of injury and do not twist any of your joint or put too much stress on the joint. So in this one is you can learn more about how to exercise safely with your arthritis. So even you have any type of arthritis, you can also do any activities that might can uh, minimize your symptoms. Um, Sport or work-related injuries to joint can increase the likelihood of to your developing osteoarthritis. So to reduce the likelihood of developing or worsening your arthritis, take a step to minimize or even prevent injuries to joint, such as wearing protective equipment when you on exercise to avoid it repetitive motion or any joint damage. So until this is my presentation, and thank you for all listening and have a nice day.